Hit it.
Good afternoon. Today I'm going to be presenting about misinformation, pseudoscience, and evidence-based practice. Nascimento et al. Argues that health and wellness industry is becoming overly saturated with frivolous claims from unqualified individuals with financial incentives. The target audience is often those with low health literacy. Content is often emotionally charged and filled with terms like just once a day, only 5 minutes a day, and see results in just 1 week. Some of the impacts that misinformation has had on public health is it can stir up a lot of confusion and can lead to people adopting ineffective or unsafe health practices. Misinformation and pseudoscience in exercise science. Pseudoscience doesn't only mislead individuals, it also interferes with the progression of exercise science as a scientific discipline. Amone et al. 2011 warns that exercise needs a stronger commitment to evidence-based practice. And social determinants of health and access to physiotherapy. Health outcomes are shaped far more by social conditions than by individual behavior. Raphael et al. 2020 states that communities on the disadvantaged end of the social determinants of health can be especially predisposed to misinformation due to their lack of access to reliable health information. Bratton et al. 2021 discusses how highlights factors such as income, education, race, where you live, and health insurance plans, all as factors that affect people's access to exercise and health improvement professionals. Why evidence-based practice matters. Evidence-based practice is based on the best available information that we have and not on traditional or outdated practices. This information is constantly evolving and changing, and that should be reflected in our behavior. And to bring this all together, misinformation and pseudoscience distort health decisions, weak evidence standards, and allows information to spread. The social determinants of health and structural inequities influence who is able to receive evidence-based care. All right, any questions from the audience?
Yes, Jenny.
Yes, Wilson?
Yeah, I have a question for you in regards to stress and misinformation.
Yeah.
You know, during your presentation, you made mention of that misinformation can worsen health outcomes. Can you please kindly explain how stress fit into this?
Yeah, that's a very good question, how stress fits into misinformation. Chronic stress is deeply connected to misinformation's impact. Raphael et al. 2020 discusses how when people face economic or social stressors, they lose the capacity to evaluate and think critically, basically. And a lot of this can lead to them adopting some unhealthy health practices, as I've said before, if that answers your question. Yes, Wilson again.
Okay, I think I have a second question for you that is related to access to physiotherapy. Yeah. So, how did the social determinants you mentioned actually affect access to physiotherapy?
Yeah, it's another very good question. Bratton et al. 2021 discusses how people with lower socioeconomic status may delay care, face difficulties in transporting themselves to facilities, and also may lack health benefits, such as like in Canada we have Blue Cross, and like with the King Grad Club we have like a health plan set up with them, and people lower on the socioeconomic gradient tend to not have those types of benefits. Any more questions? Yes, Kay?
Thank you, Jamie. So, going along with what you're saying, I have a question as regards evidence-based practice in kinesiology.
Yeah.
So my question is, what do you think physical rehabilitation needs to do to combat this pseudoscience?
What physiotherapy has to do to combat?
What do you think physical rehabilitation needs to do to combat this pseudoscience?
There's many suggestions by Amone et al. And Tiller et al. Putting research over fads or trends, trying to increase the scientific literacy of people who are receiving the healthcare, urging people to approach this type of information with skepticism. And if the evidence is strong and the accessibility is high, people become more resilient. And that's the suggestions that we should go with. Any more questions? Yes, Kay again.
Yeah, I have one more question. So this is based on social determinant and pseudoscience. So, my question is, do the social determinants of health also affect who is most vulnerable to pseudoscientific claims?
Raphael et al. Definitely supports that. People experiencing economic strain, unstable housing, food insecurity often have reduced reduced trust in health professionals. And when gaps like this happen, pseudoscience kind of takes the spot of like someone that can be trusted. And if that answers your question.
Yeah, it does.
To summarize the content, misinformation affects everything from public health to physical therapy, and the social determinants of health also play a large role in the susceptibility to misinformation and largely determine access to quality care.